Welcome to Women Mastering Midlife, where we dive deep into the rich complexities of womanhood in our middle years. I'm your host, Victoria Byrd, a pharmacist, certified women's health coach, and your guide on this transformative journey. Whether you're navigating perimenopause, thriving in menopause, or mastering midlife's many transitions, this is your weekly dose of expert guidance, compassionate support, and a judgment-free space to explore it all. Here, we're empowering women to master midlife on their terms, reclaiming our health, our happiness, and our power. Together, we'll rewrite the narrative around this remarkable stage of life, from something to dread into a beautiful, bold transition. I'm so glad you're here. I feel like osteoporosis and bone health in midlife women is such an important topic. And just fall prevention, fracture risk, in understanding that is, I feel like it's something that we're just starting to get talking about. I don't feel like it's as a common topic as other things, especially when it relates to menopausal women.
Yes.
And I was talking with Vanessa Weiland, who's a nurse practitioner up here, and she was talking about, I hadn't even thought about the fact that a low BMI actually increases your risk for osteoporosis. And so we spend our whole lives trying to be small.
Right.
And then we get older and it doesn't serve us anymore.
No.
So,
Yeah, exactly. Trying to take up less space, and then suddenly less space is less bones. And right.
Yes.
Right.
So, well, thank you so much, Dr. Moore, for coming on. I'm really excited to have you here with the Women Mastering Midlife podcast. I have not talked specifically about bone health and osteoporosis yet in over a year of episodes. So I'm excited to dive in with you.
I'm really honored to be here. Thank you for having me.
So let's talk a little bit about why you got into that practice and what made you specifically lean into bone health and osteoporosis prevention.
Sure. I've been a physical therapist for almost 30 years and done many, many things in my career. But towards the end of my career, and when I did my graduate study work, I learned a lot about cancer rehabilitation and the benefits of cancer rehab for people going through treatment to decrease their side effects, improve the effectiveness of their treatment, and improve their longevity, their lifespan, their ability to survive their cancer. That work, I worked exclusively in cancer rehab for several years, and many of my clients were breast cancer survivors. And they're at significantly increased risk for osteoporosis and fractures more than other women. And so these clients were asking me, how do I protect my bones? And I didn't know. It wasn't part of my cancer rehab training. It wasn't an adequate part of my physical therapy training in any way. And then I discovered my own osteopenia and said, wow, I need to take a deep dive. I need to learn this stuff. I need to get bone fit certified. I need to go through the Institute of Clinical Excellence for rehab professionals and understand working with older adults, get the evidence, get the research, and really figure out how do I need to change how I move for my body and how can I help my clients? And so that's why I started.
I feel like there's a lot of practitioners out there who have a similar story in their field of expertise. They start somewhere and then they also have their own life experience that pivots them into a direction that they're in now.
Yes, it becomes very meaningful and purposeful, right? You know, when people are asking for help that you feel like you should know, but also when it involves your own health and your own trajectory, and as you see your future self, you want to get really good at that.
Yeah, of course. So you started to lean into that a little bit more. And what were you finding in your, even outside of the cancer patients that you were taking care of? What were some things that you were seeing in women specifically that we needed to address in terms of osteopenia, osteoporosis?
Yes, actually, there was a really big gap, I thought, in information and guidance for people. It was really dictated to the most frail, the oldest, the people that could do the least amount safely. And there was a huge gap in addressing how to adequately exercise safely through midlife for people that were like me in their 40s and 50s that were finding out this was happening. There were not good resources. And many, many women were telling me, I find these videos and they're just too basic. They're too simple. I'm bored. I can't do that. What else can I do? So that was a piece of that I really, really felt was missing, as well as identifying this earlier in the process, having an intervention plan earlier so maybe we can mitigate even having an issue with bone health in the first place.
Yeah, so for people who don't know the terms, there's osteopenia and osteoporosis. And osteopenia is typically that early stage, correct?
Yeah, so osteoporosis is the diagnosis based on DEXA scan. Osteopenia is a precursor. So it's just a term, an identifier as a risk factor for osteoporosis. It's not an actual diagnosis, like prediabetes and diabetes. So it's that warning sign that we need to pay more attention to our bone health.
So what are some ways that women can find out if they are leaning toward the direction of osteoporosis?
Yeah, great question. The thing with osteoporosis is it's a silent disease. We don't feel it. So we're not likely to get a symptom unless we have a fracture that might indicate a problem. But family history and genetics plays a big, big role, like 50% of our risk. So if your parent, mother or father, had osteoporosis or a hip fracture, that is a big reason to have a conversation with your doctor. It's also our time in life when we're building our peak bone density, our teens and 20s. If our nutrition and physical activity wasn't optimal, then we might not have built peak bone density. If we had an eating disorder, or smoking and alcohol, things that could really affect that, those would be indications that we may want to have another conversation about getting tested earlier. Some medications, like some people will take acid blockers like proton pump inhibitors for long periods of time. And this will inhibit our ability to absorb our nutrients well and can affect our bone metabolism. Other medications like steroids, so long-term prolonged exposure to steroids, other medications like chemotherapy or aromatase inhibitors that block estrogen. So some of these clients need to really be concerned about having bone density checked earlier. We're not going to feel these signs and symptoms, but also inflammation, chronic inflammatory conditions, because inflammation is the root cause of many disease processes, including osteoporosis. So irritable bowel syndrome, Crohn's disease, rheumatoid arthritis, other chronic inflammatory things can be a sign that you want to get it checked.
I'm kind of feeling like we should all just have our bones checked at a certain point anyway.
Yes, 100% agree. Yeah, the guideline is really, I think, late. The guideline for getting a DEXA for women is age 65. And when we know that we lose bone loss so much earlier, starting in perimenopause and menopause, we want to get that baseline. We want to know ahead of time when we can really take interventions that mitigate that.
Yeah, and so what are some ways, because we see the social media clips that, you've got your bone density and your muscle mass at a certain age, and then from there it's all downhill. But I don't necessarily feel that's the case. I mean, there's got to be some ways that we can improve our bone health at any age, specifically midlife.
Yes, absolutely. Certainly we have, and so understanding this, that osteoporosis is a risk factor for a fracture. Right, so we have the quality and the quantity of the bone. The quality, how bendy and flexible is it? How strong is it? Not just how much bone we have. And so we do have wonderful things that can impact that. And especially if we're talking perimenopause and menopause, when we know we can lose up to 20% of our bone mass through this menopause transition. Understanding and communicating with our providers to see what are the pros and cons of hormone therapy for us. Is this something that we know can slow and not just slow the bone loss, but reduce the risk of fractures and help you maintain healthy bone density? So I think that's really important to have that conversation early. Many women missed out on that after the kind of false claims of the Women's Health Initiative. And we're repairing that now, right?
Yes,
we're trying to get that conversation back. We need to manage fall risk. So falls are the number one reason that someone will sustain a fracture. Well, how do we manage fall risk? Well, strength exercise is one avenue. Balance training is another avenue. So specific exercises to reduce falls. But strength training, how do we maintain our muscle mass? I say, and I teach, that muscle loss and bone loss are two branches off the same tree. They are occurring together as we get older. They're occurring together through our midlife transition. So if you're addressing your muscle strength, you're also addressing your bone strength. It has to happen. And this is really important, as well as nutrition. We need adequate fuel for our bodies, for these activities that we want to do. Protein is 50% of our bone mass. If we're not getting enough building blocks for this repair process to happen, how do we expect to have a stronger structure, right? It's like 2x4s for your home.
Yeah, I always tell women you can't build a Lego house without the Lego parts. You need the bricks. You have to have the bricks to build the house. And, we were talking before we started, just that there's this idea that we've wanted to shrink ourselves, being as small as we possibly could, be the smallest pant size, whatever it was. And that's actually done us a disservice as we've gotten older.
Yes, absolutely. Yeah, we do know that smaller framed women, more petite women are at higher risk of osteoporosis and fractures. You literally have less bone mass. And part of that is genetics too, but part of that is, yes, if we are a little bit more robust, then that is protective.
Yeah. And you said something about bendy, like pliable bones as well. And that's the difference too, having the density versus having bones that will kind of move with you versus break. Is that something that we should also be thinking about as well?
That's one of the benefits of the exercise, of doing the right types of exercises. It's not just changing the bone density, and hopefully we see a change in bone density, but you may not. But what studies do tell us is it can change the bone quality, the microarchitecture of the bone, how flexible it is, some of the cortical thickness of the bone. So this makes it stronger when stressors are applied to it, more able to withstand forces and pressure. This is what we want, not just density, but quality. And we have medications that treat osteoporosis, and they can change bone density, but they can't change bone quality. Now, bone quality is part of our exercise routine. That is where we're doing those types of things.
So we want to bounce. We don't want to break.
Yes, exactly. Yeah.
That's one of the things I keep thinking. I'd rather bounce than break. And I've seen, my husband is an orthopedic hand surgeon, and even just being on call in the winter, when those rainy months come, just the fall risks and what people are doing to their wrists and their ankles just by falling, those things we need to work on the fall risk prevention, but also there is something to be said about having strong, healthy, bendable bones that not breakable bones that prevent those kind of things.
Yeah, absolutely. Yeah, falls are the biggest cause of fractures. And we have some really scary statistics about what can happen especially if we have a hip fracture. And the statistics, and they get worse the older we get, but it's somewhere between 25 and 30% of people over age 65, if you have a hip fracture, you may not survive the next year. And that's a horrible statistic to think about. But what is missing when people are given that information is that is a great representation of that person's physical capacity at the time they had that fracture. How functionally strong were they when that happened? And it is the most frail, and those with the most comorbidities. So we know that exercise to make you more robust is going to really impact your ability to survive something, even should it happen.
Yeah, and it's also a quality of life issue. I mean,
huge.
Because when you're strength training and you have more bone density, I would think there's also a correlation to just a better quality of life.
100%. I mean, to me, that's the most important thing. Who among us wants to be told, no, you can't do anything that you love to do anymore? None of us. I want people to sail through life, SAIL, stay active and independent for life. I want you to keep doing the things you love with the people you love. That's 100% quality of life to me. I don't want to stop doing the things that I love, and boating and fishing and all that stuff. But if we don't have the strength to do that, then we put ourselves at risk. But yeah, I completely agree.
Yeah, and I think for a lot of women, the idea of spending the last 10 to 20 years in a nursing home, that's not how I want to go. I mean, and so we have to do the work now. I've had women, even girlfriends, will sit around and talk about like, oh, when I was 20, this is how my body, I miss my 20-year-old body. And it's like, well, that's great. But right now you have a 45, 50-year-old body that you need to take care of so that when you're 80, you can look back and be like, oh, that 50-year-old body I had, I sure do miss it.
I love that too. I don't buy into the ideology that we can't keep a very active life as we get older. My client a couple weeks ago said to me, Lisa, I just don't want to fade away. I don't want to, just like you say, to spend the last quality years in a nursing home. And I do think we have that ability. I say, live long, die fast, right? Live long, not live long, die slow. That slow fade away, that ability to stay active. And I don't think, well, we know there's no age limit to strength training. There's no age limit to the ability to get stronger. We have underdosed our older adults for years by not giving them the credit that they had the ability to do more. And that does start. If we're starting that in our 40s and 50s, we are completely changing the trajectory of what's possible in our future. You know, we don't have to think about stopping skiing in our 80s if we enjoy skiing. We don't have to think about stopping triathlons. We don't have to think about stopping if we can maintain and do what we need to do in midlife.
I wanted to pause for a quick moment to share a free resource I've created just for you. Did you know that after age 30, we naturally start to lose more bone than we build? Over time, this can increase the risk of osteoporosis and fractures. But here's the good news. There are simple, science-backed strategies you can use today to keep your bones strong and healthy. That's why I put together a free guide called Your Guide to Healthy Bones. Inside, you'll find the top nutrients your bones need, the best food sources, lifestyle tips, and even a breakdown of how much calcium and vitamin D you should be getting each day. It's a practical, easy-to-follow resource you can start using right away. You can download your free copy by heading down to the show notes and clicking the link for the free Healthy Bones Guide. So what do you tell your clients, your patients when they come to work with you? What is your approach to keeping people moving until they're in their 80s and 90s and beyond?
Well, mostly I want to know what's important to them. You know, what is it that they don't want to lose? And for many, it's their independence. So that ability to stay independent. For a lot of them, it's activities, whether it's, I want to be the grandparent that plays with my grandkids, that can go on hikes. I want to be the grandparent that can run around Disney. I want to be the grandparent that takes them out on these active adventures, or the parent. You know, I want to know what's important to them first. And we need to know what their exercise experience is. So for some, I have women that have been in Spartan races and they're very active, and I have some that have never exercised before in their life. And it's remarkable because they're deadlifting their body weight now, and they're doing like incredible things and realizing their power even though they never had it. So they'd never experimented with it before. So for that, I would love for people to be hopeful that even if they've never been an exerciser, their potential is still remarkable and unlimited. And that's where we can see the greatest change. But I also like to remind people not to compare themselves and their journey to anyone else, to see somebody doing certain activities and exercises and say, oh, well, that's not where I am. No, we start where you are. We start where you are, and we build on success, and we build a base, and we take our time and do it intentionally so that we have success that we can build on, because this is a lifelong program, not a 12-week program, right?
Yeah. And there's a lot of, I don't want to say misinformation, but there's some misguiding sometimes I see, especially in social media, with people who they are basically gym rats and they spend hours and hours and hours in the gym, and that's not very possible or something that people want to do. There's a lot of people who just don't feel the need to do that. So what do you tell people who they know they need to strength train? Is it, you know, they have to commit to 5 days a week, or what? Right. What do we really need to do to actually see some change? Because there's a lot of bare minimum people out there, and I get it. So what would you say to them?
I love that. Yeah. So I'll often cite the Lift More trial by Dr. Belinda Beck. It was a wonderful trial on high intensity resistance training for postmenopausal women with osteoporosis. And her trial was twice a week for 30 minutes, very specific targeted exercises. And she's reviewed that twice a week showed improvement in bone mineral density. When she tracks people over time, even once a week, they showed benefit, and 3 times a week, they showed even more. So I like to say 2 to 3 times a week. If you miss a week, don't sweat it. Even though you got once in, that's fine. There's never guilt or shame around movement and exercise. So my target is 2 to 3 times a week of targeted strength training. Understanding that we have busy lives, we travel, we do things, we have other responsibilities, that if it dips down to once a week occasionally, don't freak out. It's the big picture over what did your year look like in consistency? What did your last 5 years look like? It needs to feel achievable in a person's life. If it's not, they're not going to do it. It needs to be achievable. Yeah.
Yeah, I find that all the time. I mean, I love my strength training workouts. Those are, it's mentally healthy for me. I enjoy feeling strong afterward, getting a good sweat and whatever. But there are a lot of people who just don't like it and they don't want to spend 5 days a week in the gym.
Yeah, it's true. Yeah, it's strength training. It's true. It's different, especially if you've never done it. Yeah, 5 days a week is a lot, and you have to. You're breaking down their back and biceps, and just the different muscle groups to work, and it becomes just too confusing. And and often if they don't know what to do, if it's not clarity in that, then it's easy to have stuff on the elliptical and the treadmill, and that's great exercise. Aerobic exercise is fantastic, but it doesn't cut it when we really talk about bone density.
What are your feelings about the weighted vest and bone density?
Yeah, I have feelings about that. Yeah, I have feelings about that. I don't think that the research really supports it. So most of the studies I've looked at, it's weighted vest plus exercise increases bone density. Well, which was it? Was it the weighted vest or was it the exercise? And as a physical therapist, there's certainly many people that I've worked with that I would absolutely not want wearing a weighted vest, who may have different degenerative disc disease, disc herniation, spondylolisthesis, things that would just make that an unsafe tool in their tool belt. And if people want to wear it, I don't see that there's a problem for people that are able to tolerate wearing a vest. I don't know that it provides as much return on your time as targeted strength training does.
Yeah. And I mean, I was an early adopter of a vest, I'll be honest, but I felt like it changed my center of gravity and I was less stable. And so I was just thinking from a stability standpoint for women who, if you're out walking outside, especially, it can be dangerous. And if you're worried about osteopenia or osteoporosis, and you have a vest on and you fall, then you're fracturing something. That's not helping anything.
Yeah, agree completely. And for that same reason, I don't recommend ankle weights or wrist weights when we're walking. Yeah, is that ability to respond to a fall. Yeah, I don't wear a weighted vest, and I generally don't recommend it. When I have people that say, I really want one, I don't oppose it if it is okay for them and their spine health. But I think targeted strength training is a better bet.
So for targeted strength training, do you prefer like full body workouts of functional exercises, or do you prefer more of targeting like different parts of the body at a time in a full body? Does that make sense? Like the compound movements versus individual movements?
Yeah, I really like functional exercises. I like it to translate to things that we need to do every day. I like that a suitcase carry is really applicable to how we carry groceries. I like step ups and stairs. I like thrusters. I love compound full body movements. I just think they're way more, they translate to our everyday life much better and how we need to move and have stability. And that's how I like to design programs. I like to make sure that we're including upper body, lower body, core, stability, balance, and posture, that all of that is addressed in a single workout. Then we know we've touched all the bases.
Yeah, I was talking to my dad once about working out. He's like, you need to not pick up those weights. You're going to hurt yourself. And I'm like, okay, so when I'm traveling Europe and I need to get a suitcase up over my head, that's a thrust. That's a squat to thrust. I've got to do it. And don't tell me I can't travel to Europe and put my own suitcase overhead on a train, because that's just not going to be okay with me.
Absolutely. Or picking up kids, or, gardening. There's so many things that we're lifting, pushing, and pulling. And that is where we want to make sure that we have the strength to do and the capacity to do those things. People talk a lot about the association with grip strength and longevity. And people think, well, I need a gripper to improve my grip strength. But what grip strength really tells us is how physically active you are. How much are you lifting and pushing and pulling in your regular daily life? Because if you are, you're going to have great grip strength.
So you don't need the gripper things.
No, you need to carry heavy stuff.
Yeah. And why would you want to take 20 trips to the car for the groceries when you could just do it in a couple?
Never. I always want to get every bag on each arm. Yes. We need more videos like that.
Right? I mean, I actually prefer if I could get them all in one. I'm a champion. I feel like I've won something if I can do it all in one trip.
Absolutely. Gold medal.
Yeah. So speaking of groceries, I do want to talk about nutrition a little bit, because I think that's just as much of a component as movement. What do you suggest for your clients and patients about their nutrition for bone health?
Yeah, I think that following an anti-inflammatory type of diet for them is really important. And how I address that big picture is eat real food. So eliminate processed foods, no highly processed foods. Let's eliminate processed foods. Let's get real food, mostly plants. So lots of plants. I'm a plant forward in my recommendations. I eat animal proteins, and I address we need to have adequate protein intake. I usually recommend between 1.2 and 1.6 grams per kilogram of body weight. I try to get them to aim for the top end. I find clients really struggle to get enough protein. So I like to make the goal reasonable to start with, food-based first, and then looking at supplements later if we need to do that. Being careful of sugar, being careful of alcohol especially, and getting a big variety of plants and colors. I think the phytonutrients in that are so important. And then identifying any sensitivities that may be causing issues with absorption and maybe causing issues with our bowels and our GI system. And that where I usually refer to people that are specialists in those areas to look at that kind of thing. And then calcium through food as much as possible. Whether it's dairy or plant-based, I don't care, but I just want to make sure people are getting as much as possible through food sources or supplement that is more of a food quality type supplement.
Yeah, I've been listening to some research and looking at research on calcium supplementation because I was talking with a pharmacist and a food researcher who developed a food-based calcium supplement. And I didn't realize how poorly absorbed a lot of those supplements can be.
Yeah, and cause GI distress and constipation and kidney stones, and then we're worrying about the coronary calcium. And so a lot of those synthetic calcium sources, they have different risks. And so getting food-based calcium that's priority one if we can figure out how to do that.
And I think the last thing I really want to touch on is hormones. And what are your feelings? I mean, we talked a little bit about hormone therapy, but estrogen and bone health, I feel like that's something that women really need to understand.
Yeah, our hormones are really, really critically important in our bone health. So estrogen plays a couple of roles. One, it's a bit of a modulator for some bone cells. A bone cell called osteoclasts with a C because they're cleaner cells. They clean out old bone cells so that the osteoblasts, the builder cells, can deposit new bone cells. And estrogen is a nice modulator to those. But when estrogen leaves the building, then those osteoclasts are kind of unchecked and go too fast in resorbing old bone, and the new bone builders cannot keep up. So that's what accounts for the dramatic loss of bone through the menopause transition. Whether you entered menopause surgically and early in life, then you have more time where you have decreased exposure to that estrogen that helps to protect your bone. So, and estrogen also, I was listening to a Peter Attia lecture recently, and he's talked about estrogen as a signaler for stress. So when we're stressing our bone with exercise, estrogen plays a role as a signaler to increase the bone building cells.
So having estrogen leave the building is a big problem for women.
Yes. Yeah, that creates a lot of change. It also plays a really important role in collagen development, matrix, and healing and regeneration. So collagen and estrogen are also connected. So some of the early signs that you may notice of an effect on your collagen tissue could be like the frozen shoulder, plantar fasciitis, gluteal tendinopathy, just aches and pains more in your joints. An increase in arthritis if you had x-rays or something, your doctor said you newly diagnosed with arthritis. So we'll see these changes in our collagen, which is also cartilage tissue, that is the result of this decrease in estrogen. So collagen is part of the matrix of our bone. Collagen disorders lead to osteoporosis. So that estrogen collagen bone connection is really important.
So for midlife women who are listening to this episode and they're starting to get, I'm sure there's some validation of like, oh, my creaky knees and my frozen shoulder, it's not just me being crazy or part of getting old. I'll put that in air quotes. What would you say are some key things that women should be focusing on at this point in their life when it comes to terms of bone health?
Sleep. Sleep is our superpower. Sleep is rest and regeneration, and it is really affected in midlife. So prioritizing sleep, it's also anti-inflammatory. So sleep, I think, is critically important. Stress management, is critically important. These are all things that are helping to address inflammation. Movement that's not just strength training, but also joint mobility. Having healthy, happy joints that can move through a full range of motion provides this stable base where we can do strength training. So whether it's a yoga or Pilates practice or some other type of mobility practice, joint mobility will help us through the lifespan so we don't lose the ability to get down on the floor and to get in certain positions that we need to. And then I think one of the things that I see a lot in clients that needs to be different than how we trained when we were younger is overtraining. Thinking that we can work on an empty tank like we did in our 20s when we were tired, sleep deprived, and underfueled.
Yeah.
So readdressing how we exercise smartly and allow for repair, regeneration, and rest and recovery.
Yeah, those rest days are way more important than people think they are.
Yeah, they're critical.
Yeah. Well, so thank you so much for your time. I think that it's eye-opening to understand the necessity for movement and flexibility and sleep and anti-inflammatory foods and lifestyles. So thank you so much for joining me on the podcast today. I appreciate the time.
It was such a pleasure. Thank you for having me.
Thank you for listening to this episode of Women Mastering Midlife. If something you heard today resonated, I'd be so grateful if you'd share it with a friend who might need a little extra support on her midlife journey. Remember, small changes can make a big difference, and you don't have to navigate this transition alone. We will be back next week with more expert guidance and compassionate conversations to help empower you to master midlife on your terms. Until then, you can find us on Instagram at Women Mastering Midlife, or come connect with me directly at Miss Victoria Byrd. And you're looking for deeper connection and support, be sure to join us in the Women Mastering Midlife community. We'd love to continue the conversation with you there. If you've enjoyed this episode, please rate and review this podcast. It helps us reach more amazing women mastering midlife just like you. You'll find all the links from today's episode and ways to connect in the show notes below. See you next time.